Okay, so we're going to be talking about importance of regular bowel movements and its characteristics. So some key points we want to point out to you guys is bowels vary from child to child, and most children have bowel movements 1 or 2 times a day, and others may go 2 to 3 days or longer before passing a normal stool. So it just depends on each child. For example, a child that is healthy and has normal stools without discomfort or pain, having a bowel movement every 3 days may be normal for that child. So we're going to talk about constipation. So it's temporary and can be easily treated. And some characteristics about constipations are when the stool is hard, dry, or the child is having difficulty or pain when passing stool. Causes of these can be not enough fiber or not enough fluid. You can also, another cause could be if the child is sick or has lost their appetite. Also, like certain medications can cause constipation, as well as medical conditions such as hypothyroidism. And also sometimes children hold on to their stool, so that could be another reason. And then other changes in the child's life can also contribute to constipation. So symptoms, it includes many days without normal bowel movements. Again, hard stools that are difficult to pass or are painful, abdominal pain, rectal bleeding from tears called fissures, soiling, poor appetence, cranky behavior. So to treat constipation, it depends on what the doctor thinks it's best. But increasing movement like exercising and increasing fiber and fluids usually helps the issue. And then something to know as parents, it's to never give laxatives or enemas unless your child's doctor says it's okay, because it could be dangerous to children if they're not used properly.
So your child may experience diarrhea. So this is defined as frequent soft and loose stools. Like constipation, it's typically doesn't last long and it's cured pretty easily. So it can be caused by multiple different things. So it can be a virus. Your child could have the stomach flu or something called the rotavirus. It can also be caused by a bacteria, E. coli, salmonella, so food poisoning, possibly a parasite, or their diet or nutrition. So if if they intake high fiber or high sugar, if they have food allergies, if they're lactose intolerant, or they have celiac disease. So if your child does have diarrhea, they may need some electrolytes to replace ones that are frequently lost. Let's see, this is helpful if the diarrhea is mild to moderate. So some examples you can give them is Pedialyte, or you can give them a half Gatorade, half water mixture. So you can pour out half of the bottle and then fill the rest with water just to lower the sugar, which because sugar can increase the diarrhea more. You can watch for signs of dehydration as a result of too much fluid loss. So they'd have decreased urine. If they start crying, there's no physical tears forming. If they have dry mouth or skin, and if their eyes appear sunken. You do not want to use anti-diarrheal meds unless your doctor says it's okay. And you want to take your child to seek medical attention if there's blood in their stool, if they get a fever that's above 102 Fahrenheit, or if you notice significant changes in your child's behavior.
Okay, so healthy bowel habits for your children. Regular bowel movements are important to your child's health. Bowel movements will vary from child to child. Some children go more than once a day, while others may skip a day. So ways you can encourage healthy bowel habits for your child is eating healthy foods, such as whole grains, fruits, and vegetables, and drinking more water each day. Excellent sources of fiber have 5 or more grams of fiber per serving. The American Academy of Pediatrics recommends no more than 120 to 180 milliliter of 100% fruit juice per day for children ages 1 to 6 years. Less is better. This is because fruit juice contains a lot of sugar and can cause diarrhea from the excessive amounts of juice. And water is a better option for your child. But however, if your child is constipated, AAP does say that it's okay to give them small amount of fruit juice to help with the constipation. And juices that begin with the letter P are good for constipation. So remember, peaches, prunes, pears will make you poop. And then staying active, keep your child active throughout the day. This will help promote healthy bowels and keep them working well. And then give them lots of positive reinforcement. Most children usually hold in their bowel movements because they have a painful past experience with passing stool. So as parents, you can take steps to keep your child's stool by keeping it soft, including plenty of water, eat high fiber diets, limit amount of dairy, and limit constipation food like fast food and fatty food. You can also pick a few fun activities to do in the bathroom to encourage your child to sit longer, such as reading and singing a song. And not using negative words like dirty or stinky because they can make your child feel self-conscious about going to the toilet. And this is the Bristol stool chart. We use this chart to talk about shapes and types of stool. This chart can help determine what's normal and abnormal. And there are 7 types of stools. Type 1 is severe constipation, and type 2 is mild constipation. And these 2 types means that there is low intake or fiber and fluids. And type 3 and 4 are normal stools. And type 5 is lacking fiber. Your child needs more fiber in their diet. And type 6 is mild diarrhea. Type 7 is severe diarrhea. And these 2 types are likely caused by an infection, inflammation of the gut, irritable bowel syndrome, food intolerance, or dehydration. And if your child has consistent diarrhea, you should go see the pediatrician.
Okay, some tips about potty training. Children are normally ready for potty train before the age of 2. Some may wait until 3.5 years old. Signs of readiness for potty training are fewer wet diapers, bowel movement become more regular, child becomes more vocal about going to the bathroom, child notice or doesn't like dirty diapers, and some tips for parents about potty training. Don't make your child sit on the toilet against his or her will. Show your child how to sit on the toilet. Establish routine. Have your child to sit on the potty within 15 to 30 minutes after meals. This is according to tendency for bowel movements. Empty a bowel movement from diaper into toilet. Avoid clothes that are hard to take off. Offer small rewards and praise all attempts to use the toilet.
So even though a child gets potty trained, sometimes they can experience potty training regression, which is basically when they regress and their established potty practices get neglected, either by constant accidents or them return if they've got a desire to return to diapers or pull-ups or whatever they were wearing before. Usually it's caused to some sort of stress in their life, whether it's environmental or a new routine. So it could be a new preschool, new babysitter, a new sibling or sibling on the way with pregnancy, parents divorce, move to a new home, any kind of death in the family, or anything that's going to cause them stress can cause them to start wetting the bed or wetting their clothes again. And then sometimes it can be due to a medical reason. So if you can't find obvious stressor in their life, it could be an infection or something that needs further medical evaluation. But tips to overcome this would be try to identify that source. So like I said, try to find out if there's a obvious stress in their life. You can ask them if something's bothering them, or to kind of want to get their input as far as what's going on, because they might be able to tell you. Be sure to be compassionate and sympathize with them in their time of stress, because they can be disoriented and they're going to need your support. Let them know it's a normal response and you're not judging them for going backwards in their development, because usually it's just a temporary thing. Take steps to fix the issue. So spend extra time reinforcing bathroom habits. You might have to do some additional potty training, and that's okay. Allow the child to also offer their ideas on how to correct the issue, because it'll make them feel more involved and independent, and they'll be able to own the challenge and kind of feel more accomplished once they do overcome it. You want to be clear with your expectations. So let the kid know that even though they're experiencing difficulty, that you do expect them to get back to where they were, and that you're going to help them out and do it. And be sure to give them praise for their successes and support them when they have failures, because they are likely to have slip-ups. These are our references. Thank you. Hope you enjoyed the show.